I think that's an excellent question for us to ask ourselves. Are CAR T cell therapies safe for patients with impaired renal function? As everyone who treats patients with myeloma knows, patients who had impaired renal function were not included in the pivotal clinical trials of CAR T cell therapy for myeloma, including both the KARMA trial and the CARTITUDE-1 trial that led to the FDA approval of idacaptogene viclucel or ide-cel and ciltacabtagene autoleucel or cilta-cel, respectively. So we don't have any clinical trial data to establish the safety of CAR T in patients with renal impairment. And this is such an important cohort of patients. Cast nephropathy is a hallmark feature of multiple myeloma. Over a quarter of patients with myeloma have renal impairment. So this is a very important subgroup. So what we did was we looked at this in a multi-center study through the US Multiple Myeloma CAR T Consortium, which I'm privileged to be a co-leader of. And we had multiple centers contribute their data for patients with renal impairment who received ide-cel or idacaptogene viclucel CAR T therapy. And we compared their outcomes, both for safety and efficacy in patients who had normal renal function. We defined impaired renal function as having a creatinine clearance of less than 50 milliliters per minute, with severe renal insufficiency described as having a creatinine clearance of less than 30 ml per minute or being on dialysis. We had about 28 patients who had renal impairment, out of which 11 had severe renal impairment, including one patient who was on dialysis. And what we found was very encouraging. The efficacy outcomes in terms of response rate and progression-free survival in patients with impaired renal function were very comparable to those patients who had normal renal function. Similar response rate, similar progression-free survival. The non-relapse mortality was also no different. In terms of other safety parameters like cytokine release syndrome and neurotoxicity, we did not observe any differences. We also did not observe any differences in rates of infections. We found some minor differences, including the fact that patients with renal impairment tended to have longer hospital stay and higher need for ICU stay. Again, the exact reasons behind this are not clear yet, and we are investigating that. And it might be possible that doctors treating patients with renal impairment are more conservative. The other thing that we found is that in the short term, patients with renal impairment are more likely to have high-grade cytopenias at day 30, but this is equivalent by day 90 and comparable to patients with normal renal function. So in summary, CAR T-cell therapy is feasible, safe, and effective in patients with impaired renal function, with some minor differences in terms of side effects like cytopenias. And again, this creates evidence for feasibility and the fact that we should not be excluding these patients in future clinical trials of CAR T, whether we include them in the main group or create special cohorts, because again, a fourth of patients with myeloma have renal impairment, are both, good approaches, but we should make an effort to include these patients in clinical trials and definitely offer them CAR T as part of routine care.